Hello, my friends. I'm Dr. kenD Berry, urologist and senior health specialist. 0.055 seconds. And today, we're going to have one of the most important and potentially life-saving conversations about medical tests that doctors routinely order for 14 second seniors over 70, but that may actually cause more harm than good, and that you have every right to question before 21 seconds agreeing to them. I believe it's time to bring this critical medical information to light with evidence that the health 0.2727 seconds care system rarely communicates clearly to older adults. Because when we understand which medical tests provide 0.3535 seconds, real benefits versus which ones create unnecessary anxiety, false diagnosis, 0.4141 seconds, and dangerous overt treatment in seniors, we don't just protect our health. 0.4646 seconds. We make informed decisions that can literally extend our quality of life and longevity. So, welcome back to this 0.5454 second space where patient advocacy supersedes medical protocol and where informed decision replaces blind compliance. 1 minute 2 seconds. Whether you're over 70 yourself or caring for an elderly loved one, this information could be crucial for avoiding unnecessary medical 101 minute 10 seconds interventions that do more harm than good. Because here's the uncomfortable truth. I've observed during 25 years of geriatric urology practice. 211 minute 21 seconds. There are 5 medical tests routinely ordered for seniors over 70 that often lead to overdiagnosis, overt treatment, 291 minute 29 seconds, and serious complications, but that 91%, 331 minute 33 seconds of doctors never honestly discuss the risks versus benefits with their elderly patients. Now let's go directly to the 411 minute 41 seconds medical tests that have me deeply concerned. After 2.5 decades of watching them harm more seniors than they help, the question I constantly 1 minute 50 seconds receive is this. Doctor, I'm 73 years old and my doctor wants to order multiple tests, including a PSA for 81 minute 58 seconds prostate cancer, a colonoscopy, and several others. But I've heard that some tests aren't necessary at my age, and 2 minutes 6 seconds might even be harmful. Which test should I question? 211 12 minutes 11 seconds. What does the medical evidence really say about testing seniors over 70? 272 minutes 17 seconds. This is the question that comes from confused seniors facing aggressive testing protocols, arrives in consultations from families watching. 252 minutes 25 seconds. Their elderly loved ones undergo unnecessary procedures and reflects the growing awareness that more medical intervention isn't always better. 352 minutes 35 seconds, especially after 70. I want you to stay for this complete medical revelation because by the end you'll have 254 and 42 minutes 44 seconds, information that can protect you or your loved ones from unnecessary medical harm while still maintaining appropriate 12 minutes 51 seconds healthcare. All right, let's start with the medical reality that few doctors communicate honestly. 2,582 minutes, 58 seconds medical testing after 70 requires a completely different risk-benefit analysis than testing younger adults. 3,083 minutes, 8 seconds. What might save lives at 50 can cause serious harm at 75. But the medical system often applies the same protocols regardless of age and life expectancy. 3.193 minutes, 19 seconds. But as with all aspects of geriatric medicine, individualized assessment based on overall health, life, 3,263 minutes, 26 seconds, expectancy and quality of life priorities is absolutely crucial. 323 minutes, 32 seconds, own-size-fits-all testing protocols ignore the complex reality that aggressive medical intervention often reduces rather than improves outcomes in seniors over 70. 3,133 minutes, 43 seconds. So let's start with the specific medical fundamentals. 3,473 minutes, 47 seconds. Which 5 tests are routinely overordered for seniors over 70? Why are they potentially harmful at this age? 3,563 minutes, 56 seconds. What does the medical evidence really say about their risks versus benefits? 4 minutes, and most crucially, what questions should you ask your doctor before agreeing to these tests? 4,074 minutes, 7 seconds. Let's start with the testing realities that your doctor probably won't explain voluntarily. 4,034 minutes, 13 seconds medical test to question number 1, PSA screening for prostate cancer after age 75. This is the most commonly 4,224 minutes, 22 seconds overordered test that causes massive harm in elderly men. The U.S. Preventive Services Task Force explicitly, 4294 minutes, 29 seconds, recommends against PSA screening for men over 70 because the harms outweigh any potential benefits. 4374 minutes, 37 seconds, here's why. Prostate cancer in men over 70 is typically so slow growing that you're far more likely to die with it. 454 minutes, 45 seconds than from it. But PSA screening leads to biopsies, which cause infections. 14 minutes, 51 seconds, bleeding and pain. Then aggressive treatments, surgery, radiation that cause permanent incontinence, and 4,584 minutes, 58 seconds, erectile dysfunction. All to treat cancers that would never have caused problems during your remaining lifespan. 55 minutes, 5 seconds. A landmark study published in JAMA followed 76,000 men and found that PSA screening in men over 70 showed 0. 35 minutes, 13 seconds mortality benefit, but caused significant harm through overdiagnosis and overt treatment. You're undergoing serious 5205 minutes, 20 seconds risks for no survival benefit. The question to ask your doctor, given my age and overall health, what's my actual life expectancy? 15 minutes, 31 seconds, am I more likely to die with prostate cancer or from it? What are the specific harms of the biopsy and treatments you're recommending? 15 minutes, 41 seconds, medical test to question number 2, routine colonoscopy after age 75. 5.495 minutes, 49 seconds. Colonoscopy is extremely valuable for colon cancer screening in younger adults, but after 75, especially if you've had previous normal screenings, 95 minutes, 59 seconds, the risks often outweigh benefits. 6,016 minutes, 1 second colonoscopy in elderly patients carries significantly higher risks of perforation, hole in the colon, severe. 6,086 minutes, 8 seconds bleeding and complications from anesthesia. 6,126 minutes, 12 seconds. The complication rate in patients over 75 is 3 DMAR, 4 times higher than in younger patients. Additionally, if 6,196 minutes, 19 seconds polyp are found, the treatments carry even more risks. The American College of Physicians recommends against screening 276 minutes, 27 seconds, colonoscopy in adults over 75 with average risk who have had previous negative screenings. 356 minutes, 35 seconds. The likelihood of developing treatable colon cancer that will affect your lifespan is extremely low, while the procedure risks are significantly 36 minutes, 43 seconds elevated. The question to ask, given that I've had normal colonoscopies before, 506 minutes, 50 seconds. What's my actual risk of developing colon cancer that would affect my lifespan? What are the specific complication risks at my age? Are there 7,007 minutes less invasive alternatives like stool tests? Medical test to question number 3, routine mammography screening after age 75. 107 minutes, 10 seconds, similar to prostate cancer screening. 137 minutes, 13 seconds. Breast cancer screening in very elderly women often leads to overdiagnosis and overt treatment of cancers that would never cause problems during remaining lifespan. 37 minutes, 23 seconds. A study in JAMA Internal Medicine found that mammography in women over 75 detected many cancers, but treating them didn't improve survival. 47 minutes, 34 seconds. Instead, it led to surgeries, radiation. 377 minutes, 37 seconds, and chemotherapy that significantly reduced quality of life without extending it. The harms include not just 457 minutes, 45 seconds, the anxiety of false positives, but the very real damage from treating slow-growing cancers that pose no threat. 37 minutes, 53 seconds. Breast cancer treatments in elderly women cause significant complications and may actually shorten rather than extend life. The question to ask, what's 8,028 minutes, 2 seconds, my realistic life expectancy considering my overall health? If a slow-growing cancer is found, would treating it 108 minutes, 10 seconds actually extend my life or just reduce my quality of life? 148 minutes, 14 seconds. What does the evidence show for women my age? Medical test to question number 4, 218 minutes, 21 seconds. Aggressive diabetes screening and tight glucose control targets in frail elderly. While diabetes management is important, 308 minutes, 30 seconds, extremely tight glucose control, HbA1c, under 7.0 in frail elderly patients causes more harm than benefit through dangerous hypoglycemia. 418 minutes, 41 seconds. Multiple studies have shown that aggressive glucose lowering in elderly patients increases mortality rather than decreasing it. 8,508 minutes, 50 seconds, the risks of severe hypoglycemia. 8,538 minutes, 53 seconds, confusion, falls, hospitalization outweigh any theoretical long-term benefits in patients with limited life. 9 to 9 minutes expectancy. The American Diabetes Association now recommends relaxed glucose targets for elderly patients. 9,079 minutes, 7 seconds with limited life expectancy. HbA1c of 758.5 is appropriate for many seniors. Yet, 9th on 159 minutes, 15 seconds. Doctors often aggressively treat to lower targets, causing dangerous complications. The question to ask, 9-2 and 39 minutes, 23 seconds given my age and overall health. What glucose targets are appropriate for me specifically? Well, what are the risks of 9,309 minutes, 30 seconds, hypoglycemia with tight control? Would a more relaxed target actually be safer? Medical test to question number 5. 9,409 minutes, 40 seconds, routine cancer screening with CT scans and extensive imaging. Many doctors order routine CT scans, PET scans, and 9,489 minutes, 48 seconds, other extensive imaging for elderly patients just to check for cancer. These tests expose patients to significant 9,559 minutes, 55 seconds radiation, and almost always find incidental findings that lead to further invasive testing. The problem is that 10:03, 10 minutes, 3 seconds, many of these findings are clinically insignificant. They're abnormalities that would never cause problems during remaining lifespan. 10:11, 10 minutes, 11 seconds, but once found, they trigger cascades of biopsies, surgeries, and treatments that cause real harm while providing no 10:19, 10 minutes, 19-second survival benefit. A study in JAMA Internal Medicine found that incidental findings from imaging in elderly 10:27, 10 minutes, 27 seconds, patients led to complications from follow-up procedures in 23% of cases with zero improvement in survival. 10:36, 10 minutes, 36 seconds. The question to ask, what specific symptom or concern makes this scan necessary? 10:42, 10 minutes, 42 seconds. What's the likelihood that any finding would actually change my treatment or extend my life? 10:49, 10 minutes, 49 seconds. What's the risk of finding things that lead to harmful interventions? Let me give you a specific example of how these tests cause harm. 10:57, 10 minutes, 57 seconds. A 78-year-old patient came to my office after his primary doctor ordered a routine PSA test despite his age. 11:05, 11 minutes, 5 seconds. The PSA was slightly elevated, leading to a biopsy that caused a severe infection requiring hospitalization. 11:14, 11 minutes, 14 seconds. The biopsy found a slow-growing prostate cancer. His urologist recommended immediate surgery. 11:22, 11 minutes, 22 seconds. When I evaluated him, I calculated that his life expectancy was approximately 8 to 10 years based on his overall health. 11:31, 11 minutes, 31 seconds. The prostate cancer he had would take 15 to 20 years to cause any problems. If he had the surgery, he faced guaranteed. 11:39, 11 minutes, 39 seconds. Incontinence and erectile dysfunction for his remaining years. If he did nothing, he would almost certainly die of something else before the cancer ever. 11:48, 11 minutes, 48 seconds caused problems. He chose active surveillance, doing nothing except monitoring. 5 years later, he's 83, living fully. 11:57, 11 minutes, 57 seconds, and the cancer hasn't progressed. Had he followed the original aggressive treatment recommendation, he would have spent his last years in diapers for no 12:06, 12 minutes, 6-second survival benefit. This story isn't unique. I've seen hundreds of elderly patients harmed by tests and treatments. 12:15, 12 minutes, 15 seconds that never should have been ordered in the first place. The medical evidence is clear on appropriate testing after 70. 12:23, 12 minutes, 23 seconds, evidence point number 1. Most medical organizations now recommend against routine cancer screening in adults over 12:30, 12 minutes, 30 seconds, 75 with limited life expectancy. The harms consistently outweigh benefits. 12:37, 12 minutes, 37 seconds, evidence point number 2. Testing should be individualized based on overall health and realistic life expectancy, not just chronological age. 12:48, 12 minutes, 48 seconds, a healthy 75-year-old is very different from a frail 75-year-old. Evidence point number 3, the question isn't can we 12:57, 12 minutes, 57 seconds find disease, but rather will finding and treating this disease actually improve length or quality of life. For 13:05, 13 minutes, 5 seconds, many conditions in elderly patients, the answer is no. Evidence point number 4, patients have the right to refuse any test. 13 down, 16, 13 minutes, 16 seconds. Doctor's orders doesn't mean you must comply, especially when evidence shows the test may harm more than help. My urgent medical recommendation: 13:26, 13 minutes, 26 seconds before agreeing to any medical test after age 70. Ask these three questions. 13:3, 2 and 13 minutes, 32 seconds. Question number 1, what's my realistic life expectancy based on my overall health? 13:39, 13 minutes, 39 seconds. If it's less than 10 years, most cancer screenings aren't appropriate. 13:44, 13 minutes, 44 seconds. Question number 2, if this test finds something, what would the treatment involve and what are its risks? If the 13:52, 13 minutes, 52 seconds, treatment risks are high, the test may not be worth it. 13:57 or 13 minutes, 57 seconds. Question number 3, what does the medical evidence show about this test for people my age with my health status? 14:06, 14 minutes, 6 seconds demand evidence, not just standard protocol. You have every right to be an informed patient who makes decisions. 14 minutes, 13 seconds based on your priorities, not just following medical protocol designed for younger, healthier populations. 14 minutes, 21 seconds. And before we close, I want to mention something crucial for seniors who are taking control of their health care. 14 minutes, 29 seconds decisions, but want to ensure they're supporting their overall health and vitality while avoiding unnecessary 14:36, 14 minutes, 36 seconds medical interventions. Making informed decisions about medical testing is essential, but can be complemented with 14:43, 14 minutes, 43 seconds natural support that maintains your health and energy without the risks of aggressive medical interventions. That's 14:50, 14 minutes, 50 seconds. Why I recommend 2 natural support options that help seniors maintain optimal health while avoiding unnecessary medical risks. For seniors, 15 minutes who want gentle support for overall health and vitality while questioning unnecessary tests, I recommend organic. 15 minutes, 7 seconds, watermelon extract rich in natural L-citrine. 15 minutes, 12 seconds. It supports circulation, cardiovascular health, and natural energy without the risks of aggressive medical interventions. 15 minutes, 21 seconds. But if you're looking for complete health optimization, 15 minutes, 24 seconds, not just avoiding harmful tests, but also maintaining energy, cognitive function, and vitality that keeps you 15 minutes, 32 seconds, healthy enough to avoid medical interventions altogether. 15 minutes, 37 seconds. Then I recommend the Advanced Senior Vitality Formula. It combines Icaran from horny goat for circulation and energy. 15 minutes, 46 seconds, Tonkat Ali for natural hormone support and vitality. Fenugreek for sustained energy and healthy aging. Nettle root. 15 minutes, 56 seconds for prostate health without aggressive medical intervention, and concentrated L-citrine for optimal cardiovascular 16 minutes, 3 seconds function. Together, these ingredients support the health and vitality that allows you to maintain wellness naturally, reducing the need for 16 minutes, 12 seconds aggressive medical testing and interventions. 16 minutes, 15 seconds. You'll find both options linked in the pinned comment and video description below. Take control of your health care. 216 minutes, 22 seconds decisions with knowledge and natural support. Because quality of life after 70 depends on informed choices, not 30 hours and 16 minutes, 30 seconds. Blind compliance with medical protocols that may cause more harm than good. 16 minutes, 36 seconds. Educational content for persistent symptoms.